So karogenetic testing is a test that we test the parents. Okay, so typically it's a blood test that's done and usually includes common conditions like cystic fibrosis or spinal muscular atrophy. These are recessive conditions and excellent recessive conditions. What's important is to determine what the risks are to your future offspring. And so typically the panel that I like to use has 289 conditions. Usually if my patients are positive for any of those conditions, we test their partner to make sure that they're not at higher risk for having a child with a specific medical condition that would be concerning. So this test really gives patients more information about their genetics and allow them to determine if they need a specific treatment to decrease the risk of having a child with something like cystic fibrosis, spinal muscular atrophy, blindness, deafness, things like that. PGT-A is an acronym for Pre-Implantation Genetic Testing for Aneuploidy, which is a term that means chromosomes. So it's a test for the embryos to determine if there's a normal number of chromosomes or if there's a missing or an extra chromosome in the embryo. We determine the sex of the embryo by doing a biopsy of the embryo and doing genetic testing to determine if the embryo has a pair of X chromosomes or an X and Y chromosome.